On Health Her Way, we're asking the questions you want answered about your body.
Together with our female healthcare experts, we're diving into the questions that might seem too scary, too silly, trivial, or taboo. No topic is off limits.
Join us as we talk about Health Her Way. Welcome to Health Her Way. I'm Brooklyn Elbert.
And I'm Meredith Cunningham. And you guys, I am super excited about our guest today. You guys have heard me talk about her through almost every episode of Health Her Way. And the reason why is because this beautiful woman over here helped deliver my baby. So I have a very unhealthy attachment to her. So help me welcome Dr. Bennett Henderson, one of our OBGYNs at Covenant Health. Henderson has been with Covenant for 9 years, and she has a passion for providing comprehensive gynecological care at all stages of a woman's life. And we're going to talk today about a stage of life that I feel like is getting a lot of attention, and yet nobody still actually understands anything about it. So,
yes. There's been so many shifts in it recently, but it's super important because studies have shifted to trying to include women as 50% of the population and focusing on what issues are affecting us. And one of those biggest issues is perimenopause and the transition to menopause.
Okay, so I think we all have heard about menopause. It's when our moms crank down the AC, we all freeze ourselves out. Maybe they get a little short-tempered with us, which is probably rightfully warranted.
As I approach, I have way more respect.
Yeah. Right? Okay. So let's kind of start out with the basics. What is the difference between perimenopause and menopause? What are these two stages of life, high level?
So menopause is one point in time that it's been 12 months since you last had your cycle or a menstrual bleed. You can do lab tests at that point that say your FSH is elevated, but basically, it's that you haven't had a cycle in 12 months. Perimenopause is a little bit more complicated, a little bit more fluid, and it's a range of, some say, 7 to 10 years before menopause that comes with a lot of symptoms that we don't enjoy, but they're related to fluctuations in our hormone levels that affect our mood, our emotional state, our physical body.
7 to 10 years seems like such a long time to be going through
yes,
the transition.
PMS that won't end.
Yeah.
Yeah. And sometimes not even having PMS before and now having PMS can be a symptom of perimenopause.
So what are those symptoms of perimenopause that we should be kind of looking out for?
So, common ones that we really associate with menopause, but can be in perimenopause, are hot flashes, night sweats, insomnia, maybe related to those issues, or maybe related to anxiety, or we can't turn our brain off. Muscle pain, joint pain, brain fog. I find myself all the time in clinic being like, what was that word that I was trying to say? Or did I already ask you this? My bad. So brain fog. Keeping a good train of thought. And then physically, feeling fatigue, losing stamina, with our workouts, or motivation, feeling like our bodies don't look or feel the same, or our pants don't fit the same way. Those can all be some symptoms.
And at what age does perimenopause usually start?
Average perimenopause is early to mid 40s, but the range is late 30s to early 50s. Menopause, the average age for Caucasian women is 51. That range can change based on your ethnicity, but can range from 45 to 55.
Will every woman go through perimenopause and menopause?
Yes, but symptoms can vary dramatically. So mild symptoms of menopause occur in 20% of people. 60% of people have moderate, aware of their symptoms. And then, what would that be? 20% or so have severe symptoms. So you may have someone who's I had hot flashes for 3 months and then I was done and I'm over it. And so I don't need any help with that. And that's great. But you'll have most women that will experience symptoms throughout several years.
As someone who, we all should, goes to their doctor annually, is that the time to bring it up? Or if you're being significantly impacted, your day-to-day life is changing, don't wait till that annual. Go ahead and give you guys a call.
Yes. Yes and yes. For sure the annual is a time. And again, as it is more of a important hot topic, like hopefully your doctor's touching on your mood, what your cycles are doing, if you're having anxiety, if you're sleeping well, like, and those things all play into potentially perimenopause. So annual exams are great times to talk about it, but if that is not around the corner, for sure, you should call and ask, could this be it? The hard thing about it is it's not a like direct lab test that's going to tell you you're perimenopausal. So it really has to be about evaluating the symptoms you're having. Symptoms could be other things. So talking with your doctor to make sure you're not missing something else, but you're also appropriately treating perimenopause because it's well worth addressing with medication or lifestyle changes.
What other things are people dealing with at this age that they may think it's perimenopause, but it might be something else?
Sure. Things like ADHD, like there's a lot more adult diagnosis of ADHD these days. Anxiety, depression, insomnia or like sleep apnea, not sleeping well. Thyroid issues have a lot of similar characteristics. But even things like IBS or migraines, there's, many.
So what kind of treatment options do we have for symptoms of perimenopause or menopause?
So first of all, with lifestyle changes. So like looking at sleep hygiene, looking at the temperature, looking at the type of sheets we have, looking what we're wearing to bed, as far as heat management. The anxiety or insomnia of like not being able to fall asleep, turning the TV off, putting our devices away, playing
like restful music,
white noise, whatever that is called, stuff like that. Encouraging like working out, weightlifting, using a weighted vest, getting out and walking. It doesn't have to be that you gain 10 pounds of muscle or anything, but like that you're doing things to focus on strength building, increase protein in your diet, things like that. And as far as medications, we can do hormone replacement therapies. So part of the perimenopause change, and we talked about, it's these big fluctuations of what our hormones are doing. So estrogen could be really high, it could be really low, it can be a slow increase, it can be a wildly sharp increase. So that can cause changes in our cycle that we may notice. They may get further apart, closer together, longer, and so we would want to address that. We can do that with cycle control medications like pills, patches, vaginal rings, Depo-Provera, or an IUD, which would help regulate how often we're bleeding, or get rid of our bleeding. And then as far as those other hormonal symptoms like emotional, mental, temperature regulation, etc., estrogen is going to be the main hormone that treats those. And so that can be given as a pill, a patch, a cream, a vaginal ring. The safest method is always going to be a patch. And so that's my go-to start. And that's going to help keep our hormone level stable so that we don't have the symptoms that come with fluctuation. Then there's other things, if you're not a candidate for hormone, that can be helpful, like SSRIs or medications for like anxiety or depression. Those can have side effects that help with anxiety, insomnia, hot flashes. And then we have things like gabapentin that can help with nerve pain, that can also modulate hot flashes. And then we have newer meds that are like hormone receptor modulators, but aren't hormonal, true hormones like estrogen, that people who have breast cancer, estrogen receptor positive issues can still use. And then we have topical things. So one of the other symptoms that I can't believe I haven't said yet, but is like vaginal dryness, decreased lubrication, that can come with perimenopause, but for sure menopause. And so topical estrogen creams or DHEA suppositories can help.
So you mentioned all these symptoms, and I feel like that's a lot of ways to be uncomfortable. And sometimes when we're uncomfortable, we get a little short-tempered or easily frustrated, especially if we're not sleeping, and all these kind of things are going on. That could possibly take a toll on people we don't mean for it to, whether it's friends, family, for those of us who have toddlers that,
Yes.
are honestly honest. So how do you try to communicate to your friends, family, partner? Like, I've literally looked at my husband sometimes and been like, I don't know why I'm acting crazy right now. I can't explain it to you, but just like heads up, I don't know what's going on.
Yeah.
But like, I want to have that conversation every day, you know?
Sure.
So how do you explain, like, I'm sorry, there's something going on in my body. It's not really my fault, but if I'm taking it on you, I don't mean to. Like, how do you advise
Sure.
people to have those conversations?
Well, it's like you're going through a phase of life. It's like puberty, but like in reverse. But like you don't just have to get homework done. You have to like run your household and do your job. Like you have a lot of extra stress. You know, you felt like you had stress as a tween.
I wish I had my 15-year-old problem.
No, there's a lot going on. And so you are having these huge fluctuations that affect your mood, your physical body, your mental health, and they can come out of nowhere. So you need that support to be like, I could be unpredictable, or I need the time to go talk to my doctor so I can figure out a way to feel better. And it is important to say, like, it's not a month, it's maybe not even a year. It could be a while that I have these fluctuations. And it's stressful to not know or feel like yourself. So just support and giving a little
Grace.
extra space. Yeah, grace. But again, we should address them because there's such easy ways to feel better and help relationships to not be stressed.
Yeah. Do you see a lot of women just kind of go through this without doing any treatment, just dealing with it because it's part of being a woman?
So we've seen a lot of women go through this and not get treatment because the WHI study came out and really kind of misrepresented the actual results. We had tons of women taken off estrogen that greatly benefited from it and should potentially still be on it to this day. So we kind of cut women off by 60 and didn't start many women on it for these kind of mild contraindications that now aren't contraindications, thankfully, but kind of have a lot of catching up to do. But we see where that causes harm. So like women are more likely to have osteoporosis. They have worse cardiac risk because of prolonged estrogen deprivation. It's hard to say. But my outlook is that we want to support and keep women on estrogen if they are a safe candidate for it, as long as it is safe. So there are still some people who may have reticence or just feel like personally it's not the thing for them, and that's fine, completely fine. But I'm always going to educate them on the benefit that they could be missing out on.
Okay. So not only does it just improve quality of life, it also prevents risk of other things.
Yes. I mean, number one, our bone health, because one of our highest risk things as a elderly female is to die from a hip fracture, a fall, to never regain your mobility, your independence. And it also helps with our muscle skeletal strength. So like not becoming frail, not falling when we trip, like being able to hold our core. It helps our cardiac risk, so it reduces our risk of heart disease when we maintain an estrogen level versus letting it fall off. In some studies, like if you have an increased risk of dementia, it reduces your risk of dementia. I mean, there's so many places. I mean, basically, as a female, if you have estrogen receptors, it's affecting most of your body, the collagen in your skin, the quality of your vaginal tissue, your metabolism, like where you deposit weight. So we get more central adiposity when we lose estrogen. I mean, on and on and on. It is just such an important building block for us feeling good. And longevity.
Yeah.
Can you still get pregnant during perimenopause or menopause?
Menopause, no. Just like by definition, you're not ovulating, you're not maturing eggs. So no. But during perimenopause, yes. During perimenopause, you are ovulating and it's more unpredictable. So your risk of like unplanned pregnancy could be higher if you're not using a reliable form of preventing pregnancy.
Speaking of ways to prevent pregnancy for those who choose to do so, how does an IUD kind of complicate things with perimenopause? Because you talked about a lot of the symptoms having to deal with a period. A lot of people who have an IUD, or I guess you can tell me if that's true or not, maybe don't get one at all. And so they may not know what's really going on.
Yeah. So ideally with the IUD, it's going to take your cycle away. And the way it does that is it just locally gives progesterone to the lining of the uterus. It thins the lining of the uterus to make it not a good home to get pregnant. But the benefit of that is that you don't typically have a menstrual cycle. Some women will have spotting occasionally, and that would be completely normal and not concerning, but it could confuse you. Because when you say one of the symptoms of menopause is you don't have a cycle, then you may be unaware of, am I in that perimenopause stage now, or am I still ovulating on a regular basis and going through my hormone cycles? So it could mask some of those things. So you may find yourself kind of further into it being like, I have really felt fatigued for forever. I really can't like sit down and get my mind straight, or like I can't get up in the morning anymore to go work out, and not see those other symptoms being related to perimenopause, because you're not even really thinking about your cycle anymore, which is, again, fantastic. But what I wanted to say is that when we are on estrogen and you have a uterus, you have to be on progesterone to balance that, because if we just give you estrogen, it'll thicken the lining of the uterus, and progesterone helps thin it. And so whether that's an IUD, oral progesterone, or the Depo shot, you have to be on something.
What do we get wrong about perimenopause? Any rumors or misinformation that come top of mind?
Or is it just that we're finally having a conversation about it?
Yeah. I mean, I think that is a big part of it. I feel like, especially since, for myself at least, like our moms didn't have the same access that we do now, or didn't have the same message from their own doctors that we do now. There really wasn't a lot of conversation about it. I would say in most families, not all. But I think it is really important, like you were saying, like, how do I talk to my family about it? How do I talk to my friends, or probably most importantly, your partner? They have no clue.
About anything, but specifically about this.
Yes. So they're not going to have any insight or innate empathy to the situation, because they have no clue what's going on. So talking about it is great. So talk about it near their phone, get it on their algorithm so they can learn how to be a supportive partner for someone going through menopause. But I can't think of that like we're crazy.
Yeah.
Like that's really unfair. Like you're going through something biologic, chemical, that you may not even be anticipating or looking out for. And like you said, like, I feel like there's this one commercial of like an old man like on a diving board, and it would make me tear up, and I was like, what is this? Like, what is happening? I feel like it's a little akin to like postpartum, when you like have all of these emotions because your hormones are again having this huge shift, and your husband may look at you and go, what is going on? And it's like, this isn't out of my, wait 5 minutes.
Yeah.
I will be in a different mind frame. And it's not crazy. I mean, it's your body having to shift super quickly and adjust to an emotion, a stress, an agitation, whatever it may be.
I looked back at some of the texts that I sent to you while I was pregnant, and the fact that you're still friends with me is really impressive. Because I look back and I think I was going crazy. Like now, like I felt like just during postpartum with like breastfeeding and stuff, like I don't feel like I really felt like my normal self again until after I had stopped that. So that was a good 2 years between pregnancy and when breastfeeding, when I think I finally kind of settled down and like reflected and looked back and went like, oh my God, why did I text her? That's not a question. That's not concerning. Like, what on earth was I thinking? Or why was I worried about that? Or like, why was I so like, I feel like that was obviously like a decent amount of time to have those kind of feelings.
Yes.
So is that like something that like, if maybe women look back and be like, yeah, I didn't feel like myself, that's going to kind of be the same thing like perimenopause?
Yeah, it's going to be very similar. And like, one, I love to be helpful. So don't worry about that. Two, just because you brought this up, PSA, like that is such a difficult time in your life, and you're doing so many things, and you are overtouched and you are overneeded. And in general, as women, we try to do more than we should because we feel like it's our responsibility, and we can do everything. But like asking for help, needing support, that if breastfeeding is getting in the way of your mental health,
it's okay not to do it.
It is okay to not do it, to just pump, to just give your baby one little itty bitty bottle of breast milk a day, or never, is fine. So don't let that ruin your experience of early motherhood. Anyway, 3, yes, it could be exactly like that, again, in perimenopause and menopause, where you're unduly adding stress to yourself because you don't understand what is going on or why you're feeling this way, and then you feel bad about how you reacted or whatever. But yes, so talk to your friends, talk to your doctor, figure out a plan that works for you and that is safe for you. And that being said, there aren't many contraindications to being on estrogen, but there are a few dead stops, like if you have active breast cancer, if you have an estrogen receptor breast cancer, certain uterine cancers, if you've had a blood clot in your leg or your lung, or you're actively being treated for like a clotting disorder or really bad liver disease. But like more people are candidates than sometimes think they are.
Okay, so we've talked about perimenopause. We've talked about menopause. What is life like post-menopause? Do all of our problems go away?
They're typically either if you are well past or you are on appropriate hormone replacement. Most symptoms should be managed. The things that go on and need active treatment are hot flashes, night sweats, again, maintaining our strength, our bone mineral density, our muscles. Genitourinary symptoms, so like increased frequency, sometimes increased UTIs, vaginal dryness, decreased lubrication, pain with sex. Like those are things that will progressively worsen. And so being on a topical estrogen, which almost anyone is a candidate for, like I feel really hard pressed to find someone who can't have that. Those are things that will continue on.
Yay.
Yay.
Yay. Don't we love it when our experts come? No, actually I do, because I would rather be informed than not informed, you know?
Yeah.
And it sounds like you have a lot of tools in your toolbox to help fix a lot of these things. So we don't need to suffer. We can have a good quality of life, even through perimenopause, menopause, and post.
For sure. And I hope we will continue to spend money on studying women and following how changing our recommendations impacts that transition of perimenopause and menopause, and how long we live and how well we live. And so I think we have an even better, brighter future during menopause than perhaps some of women today have had to deal with.
We talk a lot about hormones on this show, and usually it's unfortunately not in a great light, but they also do allow us to be women and to do things like birth and stuff. So we've talked a lot about menopause and perimenopause and the bad things that come along it. Are there any benefits to it though?
Hormones are like my favorite thing. Like, you know, I started an estrogen patch. I love how it helps me feel like more focused. Like maybe I remember more words while I'm at work, etc. And I plan to do that for the rest of my life. So, you know, the benefit of hormone is high, and I'm going to do it forever. The benefit of menopause, I mean, we're women, we grow older, we know ourselves more, we're more sure of ourselves, we give less about what other people think, and that is an important part of maturing. And so, yeah, I think it's cool to like truly know who you are, where you are, what you stand for, and feel good in your body. But sometimes that takes some help.
What do they say? Nothing good comes easy. So, you know, with that confidence, with that wisdom and experience, sometimes we have to do the perimenopause stuff.
Yeah. Yes.
Well, at least we are more informed now and feel better about our options. So thank you so much for coming on today and explaining it all for us.
Yes. Thank you.
Thank you all for listening to this episode of Health Her Way. If you enjoyed the conversation, be sure to follow the podcast wherever you listen and share it with a friend.
If you have questions or topics you'd like us to cover, connect with us on Instagram or Facebook at Covenant Health, and we'll see you next time. This podcast explores health-related topics with experts in their specialty for entertainment purposes only.
The information shared and discussed should not be considered as medical advice under any circumstance and is not intended to replace professional medical advice.
The views expressed do not reflect the views of Covenant Health System. For questions related to your personal health, always contact your physician.